Hi, everyone. My name is Sean Yo, and welcome very much to our second town hall in our platform town hall series. Today, we'll be talking about restoring dignity to seniors as part of our overall series, Reimagining Ontario, Your Voice, Your Vision. As I said, my name is Sean Yo, and I'll be your moderator today. For an optimal experience, we recommend keeping Zoom in speaker view. Also, please note that this town hall is being recorded. So today, as I mentioned, we're going to be discussing restoring dignity for seniors, focusing on how we can both care for and respect our seniors. As we begin, I'd like to start with a land acknowledgement. As we open this space and our time together, I invite you to join me in acknowledging that we meet on the traditional territory and unceded land of Indigenous people here and across all of Ontario. I feel really privileged that I've been able to both listen to and give land acknowledgements for many years now, both here in Ontario and in other provinces in Canada, and learning and seeing the differences, how different communities do this and how we acknowledge different Indigenous groups has been something that I'm really fascinated by, and I think is a very important lesson that I've personally learned. I believe that we walk together along a path of reconciliation, and what I mean by that in part is that means we cannot stand still. This means how we acknowledge land cannot stand still either. Land acknowledgements are not a box to be checked or a script to be read, a video to be played. They need to be personal, authentic, real, and living. So tonight today I join you from the land, which is part of the Between the Lakes purchase, which covers Guelph and Kitchener. I'm in Kitchener right now. And this covers all the areas that I typically live, work, and play. I've read this treaty. I really encourage you to read treaties as well. One place to do that would be on ontario.ca, and I'll post the link in chat after these introductions. I think if everyone in Canada spent some time reading these treaties, even just the treaty that covers the land where you live, work, and play, that would be a meaningful next step in reconciliation and would help us continue this journey together. So from the traditional territories and unceded lands of the Anishinaabe, Haudenosaunee, and the Attawandaron, in the current territory of the Mississaugas of the Credit First Nation, I invite you to reflect on the fact that this is dish with one spoon territory where we have an agreement that this land is a shared bowl. And there's one spoon for all of us, and we must ensure that that shared bowl is never emptied. And as we work towards a better future for all people in Canada, between communities, between provinces, and between nations, we acknowledge the importance of bringing Indigenous teachings as the principle, such as the principle of 7 generations, to our leadership and governance. This is the principle that as we live our lives and build our communities, we must ensure we're planning not only for today, and not only tomorrow, but for the next 7 generations in terms of the land, all of our people, and their health. And I think there's a particular opportunity to think about how 7 generations intersects with dignity for seniors. So this event is all about understanding your concerns about care for seniors and getting your feedback to help us to inform the Green Party of Ontario's platform. As you may know, we're just about 1 year away from the next provincial election. And so the Green Party is very interested in making sure that we're listening, learning, and earning your trust and hopefully your support too, as we approach that next election. We have a fantastic guest this afternoon, and we have lots of time for questions and answers, where we'll take questions from you. Before we get started with our great guest and introduce Mike Schreiner as well, I just want to go over some housekeeping things around the town hall and some house rules. We ask that everyone remain on mute and only unmute when you're speaking or called upon. It would be really helpful too if you had your correct name displayed. We'll be using the polling feature to help guide our discussion. When prompted, we'd really appreciate if you participate in that poll. When called on to ask questions, we'll be using the raise hand function in Zoom. And during any part of today's town hall, you can type comments in the chat, but there's also going to be a special part at the end of today's town hall, where if you don't want to turn on your camera and ask a question, you can simply type your question into the chat box. Those calling into the town hall, if we have anyone on the phone, don't have access to all those features, but we'll still do our best to try to include you as time allows. I'd also like to make sure that everyone knows that, today's town hall, we have a very strong intent and commitment to making this a safer space for all guests and participants. Our equity officer is online with us today, Ranju. I want to be very clear that we have zero tolerance for hate, abusive or discriminatory language or harassment. We ask that everyone participate with respect for one another and in the spirit of community. So if we take a look at chat, I think we've got some really great introductions there, but also information about how to contact our equity officer. So if you're not feeling safe or you have a concern about anyone's safety, please take a look at that information. Okay, so before starting with our speakers, I want to kick things off with an audience poll. This will give us a chance to warm up our topic and to make sure everyone understands how the poll feature works. So the question for this poll is, when you think about senior care today, what are the top 3 issues that worry you? So all you need to do is just click your 3 choices on that, and then we'll talk a little bit about the results of that poll. I'll just give you a minute or 2 to do that. And while you're doing that, I'm going to put my link to the Ontario provincial website with treaties and reserves. And I just did the survey too. Okay, well, I hope everyone had a chance to fill out the poll. Now I'm going to turn the spotlight over to Mike Schreiner, leader of the Green Party of Ontario and MPP from Guelph. And he's going to introduce our special guest and take a look at the results of that first poll.
Thanks, Sean, and thanks to the entire GPO team for helping put this on. And most of all, thank all of you for joining us today. It is so important to hear from people across the province as we develop our 2022 election platform. And I think when it comes to policymaking, it is really important to listen to experts, and we certainly have an expert here with us today, but to also hear from people's lived experiences and just the intersection between people's lived experiences and daily how they experience things, as well as hearing from experts. I think it's so important. And I'm really looking forward to discussing with all of you just the importance of how we can restore dignity to seniors and build a system that cares for and respects elders in Ontario. And we have a fantastic guest today, and I'm just so honored to introduce Laura Tamlin-Watts, who is the CEO of CanAge, Canada's National Seniors Advocacy Organization. And Laura was also the longtime national director for the Canadian Centre for Elder Law. And she teaches a course on law and aging at the University of Toronto. And Laura's had a distinguished legal career and has been a long-time advocate for seniors and elders. And I had the honor of joining Laura along with the Green Party of Canada leader, Annamie Paul, to do a news conference on national standards for long-term care and just ensuring that we emerge from this COVID crisis and address the crisis we've seen in long-term care. And so I want to take a moment, I think, so one, welcome Laura. And 2, I'm curious, Sean, I think, is putting the poll results up. And I'm just wondering if you have any thoughts or initial reaction to the poll results from our participants.
I think it's so interesting to see that in many cases it's fairly evenly split. And that goes to show how much we have still to do. So it's not just one answer that everybody is agreeing upon. We see that people are concerned about ageism and dignity, but also how will people stay at home and age in place? And at the same time, we're seeing concerns about access to health and safety and standards for training. So this is not a surprise, but it is, I think, a great snapshot of where we should be focusing our energies.
Yeah, I had a similar impression as well. And I thought for all the conversation that's been happening around the humanitarian crisis and long-term care, it's interesting that the poll results both reflect that, but also reflect issues around making sure elders can age at home safely with respect and dignity, and also just the importance of making sure that we um, adequately care for the people who care for our loved ones as well, and particularly looking at making sure we support personal support workers, for example.
We know that the conditions of work are also the conditions of care. And that's why we need to make sure that the people who are helping to support older adults, whether they be paid caregivers in particular, but even unpaid caregivers, have the supports that they need. And whether that means increasing the wages and making sure that people have full-time work plus pensions and benefits, and that they have a safe physical environment to work within, or if it means that we're looking at how tax giver credits can help people who are providing, let's be clear, free support out of the goodness of their heart, have the flexibility to take time off of their paid employment, or make sure that they can get the supports that they need to allow them to help their family members and friends. There's a lot to do. The good news is there's a lot of agreement about what works. It really is just that political will to make those things happen.
Laura, I hope you don't mind, before we have some questions from the audience, I have a couple questions for you myself. And I'm going to ask you to wade into the debate that's currently happening around for-profit, nonprofit, long-term care, and kind of what the future of long-term care will look like. Because, we obviously know in Ontario, at least, during COVID, the outbreaks and just the tragic loss of life were disproportionately in for-profit care homes. But I want to read an email I just recently received from a constituent that is sort of related to that, but not entirely, but to this question. So if you'll give me a second, I just want to read this. So my constituent wrote, my friend spent 13 years in I won't name the for-profit retirement home, which is in the email, during which time his wife died. They had assumed that death would arrive within the scope of their budget. He has had the audacity to outlive this, despite earnest attempts by the excellent manager to seek a compromise with this particular company. My friend was given an eviction notice. The corporation did subsidize for 5 months. Thus, after 45 years in this city, he is now living with a relative far from his home community. Care for aging adults needs to be part of a national healthcare program, not under for-profit entities. And I wanted to read that because I thought it just brought a different perspective to this issue than what we've seen with COVID. And so I'm just curious if you could reflect a bit on how can we prioritize care over profits and ensure that elders receive the dignity and care they deserve.
That's such a compelling story. And we are living longer, what we call the longevity dividend. So we are living before, never so well and never so long. But it does mean that for some people, they will require 24-hour care at the end of life. Just to put it in perspective, and the poll really talked about that as well, 92% of Canadian seniors, and this is true in Ontario specifically, will never live in institutional care. So they do need to think about aging in place. When we started the Canada Health Act in 1987, we only lived till 76.4 years. We didn't really have long-term care because people, went home and they died at home, or they may have gone to the hospital for something and then they died in the hospital. We didn't have this extra time where we may need so much nursing care. I think it's very clear that we should have included, if we were thinking about our aging communities, long-term care in the Canada Health Act. I really can't think of any reason why we wouldn't have done that except lack of foresight. Now we're in this very peculiar state where we have this combination of retirement homes, which is what this person was in, and we have long-term care. And because we're so short of the long-term care, people are having to spend their own money in private homes, which are in many cases offering the same types of care that you should get under the long-term care homes, but you have to pay for it. So it's important to remember that when we're talking about private long-term care homes, we're talking about the ownership model of the home, but the money is the same, right? So whether you get the money for your daily housing rate, which in Ontario is between about $60 and $82 a day. If you're in long-term care, you can never be evicted. And that doesn't matter whether or not it's for-profit, not-for-profit, or municipal. And all of the other things that attach to it, food and care and medical expenses, they're part of our care continuum. That's part of the budget. So you can never be evicted if you're in long-term care, even if you can't pay that daily rate. But because we are about 40,000 people on the waiting list for long-term care, people have to then spend their own money or they're lost. And in this case, you could spend somewhere between, say, $3,000 and $15,000. And that you can be evicted for. That's a private retirement home offering the services that our public system should offer. And in this case, it's a terrible instance if he can't get into that nursing home care that's provided by government and he's on that waiting list for years. We know that people experience homelessness and precarity, and it's absolutely untenable. We need to make sure that we have safe, publicly funded long-term care for everyone that needs it. And for people that can age at place, really robust home care, which is publicly funded. And that's another issue that people end up spending thousands of dollars, many of whom can't afford it at home. The system cannot be based on profit. It must be based on need.
Yeah, thanks for that. And thanks for providing that important distinction between long-term care homes and retirement homes, because there's a lot of confusion around that. And it's a really important distinction, especially given the long wait lists in long-term care. You know, another issue that comes up a lot, and it really came out in the Long-Term Care Commission report, but I would say so many in Ontario, but also so many other reports that have been issued. I think Doris Greenspan told me that RNAO, the Registered Nurses Association, have done 35 reports in 20 years on long-term care. But over and over again, the lack of staff keeps coming up. And just the fact that so many personal support workers are underpaid, about 48% or so are not even guaranteed full-time work. 60% of nurses right now are reporting they're experiencing symptoms of PTSD that have worked in long-term care homes. And so I'm just curious if you have thoughts on, you know, how we can address the staffing shortages in long-term care, and also just how do we improve workplace conditions for workers?
The good news is, I'm just looking at Ben's comment here. How do we fix it? This is one we actually do know how to fix. It just takes a commitment to equity and fairness, which we haven't had before. If you offer full-time, well-paid jobs with pensions and benefits, people will come. If you offer training, and we've just got finally some training programs for PSW years after we have needed, they're already oversubscribed. In Quebec last summer, they paid for 10,000 new orderlies, so personal support workers, and they got trained and paid over the summer, and they got salaries of $49,000 plus pensions and benefits. They were full up, and they had more than 5,000 new staff available by September. We can do this in Ontario too. It does mean that we need to make the conditions of care safe. And so right now we're moving towards, and we are waiting far too long for this, 4 hours of worked care. This government has said, promised it in 4 years. People don't need it in 4 years. They need it right now. But we know that we have people who are out of work. They are in need. They need jobs to put roofs over their head. And if you make working in long-term care, or for that matter, home care, safe, affordable, respectful, and financially viable, people will come. Ontarians are hard workers and they care. And so we can do it, but it means recruitment, staffing, and we need to make sure that we are, creating conditions of work which are respectful and allow people to actually make enough money to feed their families.
Yeah, I appreciate that. I mean, I just, it's sort of like, how do we expect people to care for our loved ones if we don't provide them with good working conditions? So thank you for that. And I think we're going to bring Sean back in to do another poll question. Is that right, Sean?
Yeah, we're all set for that. So thanks so much. Those are really great questions and what some really fantastic answers. But moving on, we have our next poll, which is the question is, when you think about quality of life for seniors, what are the top 3 issues that worry you? So just take a moment and I'll fill out the poll right now as well. And then we'll review what you had to say on this subject.
I'm filling this out too, by the way.
That's
So
awesome.
am I.
So what we're going to look for here is that we're going to be looking for you to ask a question. A huge part of what our town hall today is about is for Mike and the whole Green Party team to be able to listen and learn about what's most important to the people of Ontario to help form the policy that we're putting together for the upcoming election, but also to inform the everyday hard work that Mike's doing at Queen's Park. So what we're going to do is I'm going to invite people who have a question to raise their hand using the Zoom raise hand feature, and you'll find that under reactions. You can just click raise hand, and then we'll call on you, and you can turn on your camera and turn on your microphone and ask your question to be part of this. So I'll start off by saying, is there anyone who's ready to raise their hand and ask a question? I know it can be a little bit intimidating to be first. So while I wait for people to sort of, oh, there we go, Ingrid. So Ingrid, did you want to turn on, but just Ingrid, go ahead and turn on your camera. And if you feel comfortable, thank you, Ingrid, and turn on your microphone. But first, Mike, do you just want to share just a couple of your thoughts, and Laura as well, on what we see in the poll results? And then we'll take Ingrid's question.
Yeah, I just think the fact that access to activities that promote mental and physical health is so important. And I hear over and over again, here in Guelph, we're one of the few, if only, communities that actually has a community center dedicated solely for seniors, and how important that is to our community, and how I wish communities across Ontario had those types of facilities, and then also just the importance of social connection and addressing issues around loneliness and isolation. And I think one of the ways to address that is making sure that people have affordable housing and ways to connect with each other in our communities. And I think part of that is reimagining aging in general, and elder care in particular.
Yeah, I think it's really important to see those connections between well-being and safety on the one hand, and physical and mental health on the other. You cannot have good mental and physical health if you are not well nourished, if you are in precarious housing, if you're experiencing health problems. So these pieces really go together. I think that piece about loneliness is really important and well in social exclusion. Loneliness is the effect of exclusion. And so what CanAge is really focusing on is making age inclusive communities, making sure that we're looking at intergenerationalism, making sure that communities are able to support older people and that people are able to age in place. Again, those bricks and mortars walls of even the nicest looking house with the nicest looking garden can be a place of worry and loneliness. And we do know how to break down some of those barriers. And when loneliness goes down, physical and mental health goes up.
Thanks, Laura. So we're going to take Ingrid's question. Neil, I see your hand. I made a mistake. And what we're going to do at this part actually is have Mike ask some questions to all of our participants, and then you can raise your hand with your answer. So that was my mistake, sorry. But let's go to Ingrid right now.
Well, I just want to say that I had both my parents in long-term care, and it was a wonderful place for them. I have to say that PSW, the nurses, all the staff were absolutely wonderful. They loved my parents and they were well looked after. But then my mother used to complain, well, there's not enough staff on weekends. So I talked to the director about it, and he said, well, you know, we can't control that because a lot of our PSWs call in sick on the weekends. And I said, well, that's, you know, a real problem. So when I was talking to some of the PSWs, they were, I mean, I was sort of like always there. They kind of knew me and felt very comfortable speaking to me. And they said, yeah, like we're worn out. Our hours are too long. And there wasn't enough staff, and they were run off their feet. And sure, they called in sick on the weekends because they had to. So that's a real problem. There needs to be more staff. The staff I found were very well trained. Like honestly, I can't reiterate enough that they were wonderful, not just to my parents, but to everybody. I didn't see anybody really suffering or, you know, getting beat up or anything like that. I think that's rare. Like maybe it's different in other cities. My parents were in Cambridge. And the thing about loneliness is that's what happens when you stay home, when you decide not to go to a facility. Loneliness is big. I have a few friends in our neighborhood. They're, you know, the one lady, she's going to be 100 this year, and she's in very good health. The only problem is she's lonely. And I heard that if you want home care, you better be rich because it costs $20,000 for private home care per month. $20,000 per month. That's without food. So who can afford that for very long? So my question is, what is the Green Party going to say about these things? You know, I'd really like to see, for one, more staff and more home care too, because, you know, if we could avoid going to these homes, sometimes we can't avoid it. If our health doesn't, you know, if we don't have good health, we can't sometimes stay home. And, but there should be better care for in-home as well. And I'm wondering if the Green Party is planning to put that on their platform.
Yeah, so thanks for that, Ingrid. And I'm going to respond, and I'll let Laura, who has a lot of expertise in different models. But so in terms of aging at home, I actually think we can start looking at other models of aging at home. So things like co-housing, for example, where you can have your own personal living space, but then have shared living spaces. The Netherlands, for example, have done a fantastic job of helping seniors age at home, but still have community connections. There's opportunities here in Guelph. We have a community center that's dedicated to seniors that is located near where a lot of elders live at home. And then they avoid the loneliness by literally being able to you know, access the community center and all the programming and social connections that are there. So I think it's rethinking the models, obviously providing affordable access to home care, particularly personal support workers, and making sure those personal support workers are adequately paid. And many cases, they're not paid for their travel time, for example, when they're going between home visits. And then in long-term care, you're right. I think, you know, most people age at home, but increasingly as we have an aging population with more complex health needs, there are some people who have to be in a long-term care home. And I think one of the key things is the word home. To actually have long-term care homes not only provide the physical care that people need, but also to provide the care that treats it as a home and that we ensure we have adequate staffing to do that. And so the government has allocated $1.9 billion, which is a cost that it'll take to ramp up staffing in our long-term care homes and increase wages. The problem is they're not anticipating delivering that money until 2025. And frankly, seniors and the people who care for them can't wait 4 years for the money to be in place to provide for the staffing for 4 hours of care. Now, Laura, do you have some thoughts?
Just to kind of quickly build on that, we know that staffing is key. Weekends and holidays are always short-staffed and a real concern. We know that in Ontario, there's only one RN that has to be in a long-term care home. One RN, no matter how many people are in long-term care. You will see in both the Auditor General's report that came out a couple weeks ago, and also 2 days later, the Long-Term Care Commission reports very key, very specific recommendations on staffing. And in the long-term care report itself from the commission, we saw very key recommendations about staffing ratios, which I think we really, really need to think about. Again, that goes back to what we were talking about. We can get staff if the jobs are good jobs, safe jobs, well-paid and respectful jobs. We can get there, but we need to make sure that we do a professional shift in our thinking about PSWs. One of the things that we are supportive of right now is there's a bill being reviewed to help to create a professional association for PSWs. Because right now, if you have a PSW that is not either well-trained or in some cases abusive, all they have to do is just go next door and they can get another job. If you're a person who's trying to hire somebody at home and you're looking for a PSW, you have no way to look to find out if they have appropriate training or if they have a history that's negative. So we are supportive of that. And again, it's that professionalization and finding a ladder for careers in long-term care. It's available. We just need to do it.
Thank you so much, Laura. So now we're going to have Mike ask all of you a few questions. We'll try to do about 5 minutes per question. We have 3 questions, so please keep your question as short as possible so that we get as many people to participate as possible. So Mike, why don't you get started with your first question?
Yeah, so I think what I'll do, Sean, is I'm going to ask 3 questions and ask people to use the chat to provide answers for us, because that way we can, we'll be able to reflect that as we move forward,
Sounds
but also
great.
maybe provide that as a framework for the questions you ask us.
Sure.
And so the 3 things I wanted to ask is, in the world that you want to see, what does long-term care look like? The second one is, in the world you want to see, what does home care look like? And the third is, in the world you want, what would it look like to age in place? And so you can reflect on that in your questions and comments to us with the camera on, but also in the chat as well, for those of you who, 1, may not feel comfortable speaking, and 2, we may run out of time to allow everyone a speaking opportunity.
That sounds great. Thanks, Mike. So if you'd like to turn on your camera and turn on your mic, just raise your hand and I'll invite you to speak. I'm also taking a look at the chat right now, and I'll share some of the things that are being brought up there. Let's go ahead with Michelle.
Hi. I didn't realize I raised my hand. To me, long-term care for seniors, which I am one of, I'm rapidly approaching, I guess, more than beginning seniorhood, is a place where respect is absolutely utmost. And I don't mean just for seniors, because I think if respect goes all the way around for seniors, there will be respect for the people who take care of them. I witnessed my in-laws being looked after by amazing, amazing people, and they were valued, and we tried to pay them what they should be paid and look after them so they weren't worn out. But because so many workers in this field are women, and so many people in this field are racialized people, it has always been, it doesn't matter, it doesn't count. Not until seniors start dying in homes do suddenly elders matter in Western culture. I don't think anybody cares at all, or not anybody, that's a broad statement. Many people don't care at all until there's a catastrophe. And it's about valuing everybody. So in my mind, as I grow older, my hope is that I will be able to age in my home. My hope is that I will be able to have people here who are part of my family, which is the way the care workers were for my in-laws. They were loved and gave incredible love and care in return and respected. So I think that the key, is really comes down to respect all the way around. And of course, as you pointed out, Laura, will, because I think that is, instead of thinking about how do we win the next election, we need a government who's going to think about how do we give something to our people, all of our people, so that life can be better. Thank you.
Wow, Michelle, that was so well said. And I really like your emphasis on respect for residents and respect for workers. And I think one of the things I found really frustrating over the last year, and I don't want to be too partisan political today, but every time the premier says, frontline healthcare heroes and nurses and PSWs are champions, I want to say, well, then pay them like champions, hire enough of them, guarantee them full-time work with full-time benefits and a respectful place to work. And a lot of that is political will, and it's the political will to put the money on the table to be able to do that. And it breaks my heart that it's taken such a humanitarian crisis to put this more on the front burner of the political agenda, because we've known this about long-term care for decades, and people like Laura have been talking about it for decades. And so I think we have to seize this moment to have the political will to make the changes we need to make. And I want to give one quick example and then I'll stop talking. So before I went into politics, I worked for I helped start an organization that was about getting healthy local food into public institutions, so into hospitals, into universities and schools. And we were working with a number of very dedicated long-term care homes. And we just couldn't figure out a way to get healthy local food into the homes because the food budget was so low that it was impossible. And I just thought, what a tragedy. Food is so key to people's health and well-being, and so much socializing happens around food, but the food budget is so low, you can't even afford to buy healthy local food. And I can tell you, when I was reading the transcripts from the Long-Term Care Commission, I can't tell you how many family members and residents talked about how bad the food was. So I thought, let's at least make the investment to get people healthy food. And so it's something you can see I'm pretty passionate about and we'll keep working on.
Yeah, just to give you a sense, the food budget in long-term care is less than the food budget in prison. Not that I think that prison is a good idea, not that I think that people should, be in prison. I'm not saying that, but I'm just giving you a sense that the food budget in long-term care is usually around $8 a day. And if you are going to try to find healthy, fresh food on that dollar value, it's almost impossible. Key recommendations are to increase that to $15 a day. Again, not a lot of money if you think about what you would have in your regular groceries in a community. $15 a day for 3 meals a day does not seem inappropriate in any way. Very specific recommendations by Dr. Pat Armstrong around food. Also includes making sure food is wherever possible made on site. We see it being made in commercial kitchens and shipped in, and it's really a terrible quality, doesn't meet the health needs of residents. So food is a piece that's not a nice to have, it's actually a must have.
Yeah, that's such a great bit of data there, Laura. Thank you. But you mentioned 3 meals. I'm wondering if you've skipped second breakfast, which seems very important to me. And I'm just joking. This is a heavy topic, and I do try to at least have a smile through it.
But Sean, your point is really very well
Yeah.
taken. Many people have different food needs, and whether or not they're eating 5 smaller meals a day, whether they're fasting for Ramadan, whether they're trying to make sure that they have culturally appropriate food food, or that they have medications where they might need food at different times because they have to take it along their medications. Again, just to give you a sense, the average Canadian senior is on 12 prescription medications and takes an additional 8 supplements. So we're not talking about just a small, whether they should be is an entirely separate question. We should talk about that sometime too. But food and nutrition and supports is part of that all over. Makes good sense to members of the Green Party, but sometimes when you're talking to other parties, you get a glazed look. So it is critically important, not just to social engagement, but to well-being and physical health.
Absolutely. So Laura, I'd like to have you continue to share some of your thoughts. And what I'd like you to do is, there's been I think a very important part of the conversation and chat around the aging and dignity for seniors, but also some structural issues I think that you're pointing to in Indigenous communities. I think that's a very important topic, and maybe you could just share some of what's been happening in chat from your perspective. And then we might have time for one last question or not. We'll see from there, or one more response, sorry, from the audience, but we'll see from there.
We work very closely with Indigenous communities in Ontario and across Canada. And I was actually just speaking yesterday to some folks in Indigenous community up Island and in Vancouver Island, and talking about the fact that they have 2 beds, and that's it. Then they refer to them as beds, 2 beds for an giant northern community, and the community is wonderful and the quality of care they could provide is wonderful, but 2 beds for people with a 1,000-kilometer radius is completely unreasonable. We know that Indigenous communities want to support aging in place, but we have to look at the systemic issues. The average age of death for older adults in Indigenous communities in Canada is 63. And I don't think 63 is very old at all. And that has to do with all of the intergenerational trauma, the lack of health supports, poor quality of water, physical concerns, all of which that the folks here today have already identified early on. We know, and I remember very clearly talking to a woman from a very far northern Nunavik community, and she said, there are absolutely no dementia supports in all of Northern Ontario that she was talking about, very, very far north. And in Nunavut, there was 0. And there were no long-term care spaces available at that time. Now, it's improved a little bit since then. But when we're talking about Indigenous older adults, many of whom were part of that scoop for residential school, they are being re-traumatized by having to come to, in often Ontario, or sometimes, depending other parts of Canada, Edmonton's another area where they always have to come, and they're being re-institutionalized in their dementia years. They're not part of their community. The knowledge is not any longer part of that community. And to take the elders and scoop them again tears apart communities who would be supporting aging in place if they had the basic support. So this is a problem, again, where some of the answers are very obvious and communities are really wanting to support it. But the system that we have is re-traumatizing Indigenous seniors.
It's particularly frustrating and disheartening when we face so many challenging problems in our society, in our world, where we don't have clarity on what a solution would be. That when we have the clarity, it's really challenging to look at that and ask, why are we not doing it? I'm going to invite Viola to unmute, and this will be our last comment from participants before we move on to the next section.
I had to figure out how to unmute. So I don't know if it's a question, but isn't there a way to raise the standard of care while giving seniors themselves some of their dignity back? So when we talk about the question of food, for example, if we were to create some sort of a community garden, for example, in a care home where seniors could do the work themselves and reap the benefits themselves. And I think there's a lot of, in general, not thinking of seniors as people. So we talk a lot about the PSWs and the nurses, but we don't talk about the seniors themselves in the care homes. And I guess some of the programs that we could create that would allow them to both have their interests and have their dignity, their humanity, and also to benefit the system itself. Anyway, that's all I have to say.
Viola, just to jump in there for a second, there are wonderful programs that if we could bring to scale would be exactly that. So community gardens within long-term care, intergenerational gardening, also older adults providing expertise in food and gardening and nurturing to younger communities. Again, so much expertise. You're exactly right that these are ecological solutions, both actually ecology, but also community ecology, and they're really the way forward.
Hey, Laura, can I ask you, you had mentioned, I think I'm not following the chat as much as everyone else because I'm trying to listen, but you had talked about the butterfly model. Could you explain that a little bit to everyone? Because I think it really is a person-centered model that provides a lot of hope.
Thank you. There's a number of different brands. Think about like schools, right? There's different types of thinking around what schools are. There's different types of thinking as well about long-term care. The ones that we know work very well are what's called emotion-focused care. It's not medical focused. It's not institutional focused. It's about the individual person and their interests and well-being. Viola's comment was exactly based on what we call emotion-focused care. What is that person? What's important to that person, and how do we make sure that we integrate that? So no more uniforms, no more dispensing, no more sort of Nurse Ratched style fears. I'm not saying that that's actually what's happening, but when people get this idea in their mind, that's what they construct. Instead, the butterfly model or others, Eden Alternative, Greenhouse, they're all kind of the same thing. They strip away that medicalization. It's a home, and particularly smaller environments. 8 to 10 people often living in a communal supportive home with their own dignity and space, and then they can age in place. They can have risks. They're not being medicalized to the point where they're just locked in their room and they can't do anything. They engage in life and they engage in well-being. We have great evidence of how well it's worked. And municipal homes like Toronto have adopted that model, and also to great measured success. As one of our comments, I think it was Esther, pointed out, not new. Nope, it's not new, but we're starting to get it in Canada finally.
Yeah, thank you to Viola and Laura for that. You know, my mom has Parkinson's and she was in the hospital last summer. A very tough time because I could only visit her once a week due to COVID restrictions. And my observation was a real lack of emotional safety in her care because we've optimized our system so that each healthcare worker can visit and transact with as many patients as possible on a given shift, which is maybe not designed for the best outcomes. And the kinds of things you're talking about really seem to be focused on a time where we designed these systems with the health practitioner in mind and not the patient in mind.
It's exactly so.
Yeah, I'm just gonna, is Mahesh still on the call? I know that Mahesh was having, I just saw that Mahesh was having trouble raising their hand. And if Mahesh was still on the call, I'd invite them to share a comment. If not, we'll come back to Mahesh if that's possible. We're going to shift now. I'm just pulling up my notes, which I just lost one sec. We're moving to the actual Q&A portion, which I jumped ahead to a few minutes ago. So please continue asking your questions and your reflections in chat. We'll be very happy to continue answering those questions. I also know that sometimes it takes a little while to frame your thoughts. So I'm going to start off with a submitted question that we got from online from App Ship Guy 2002. How can we get our OBC, Ontario Building Code, updated to reflect the aging population, to get housing built that is more functional to allow to age in place, adaptable housing, so that we can serve all users' need, no matter how or where they live? We're failing in building the right type of housing. So I'm going to pass things over to Mike and Laura to reflect on that question.
What a great question. And I think one of the things is to incorporate accessible design in the Ontario Building Code, which would not only support aging in place, but also better support people with disabilities. And we should keep in mind, actually, there are younger adults who live in long-term care homes because they have no other place to live that can provide care. And oftentimes it is people with significant disabilities. And I'll just quickly, before I turn it over to Laura, say that it is far less expensive to incorporate those design elements into the home, the house, the condo, the apartment when it's built in the first place than to try to renovate it later. And I think that's one of the reasons it's so important to have it in the building code itself, because then that becomes the design standard for all new builds.
I absolutely agree. The pushback, and not one I agree with, let me be clear. The pushback is every time you change building codes, you make them more expensive. And that if you have a 6-foot door, making it an 8-foot door is more expensive. And what we need to do is move to a universal design standard. We know that building codes are a key component of that. And just to build off of that, no pun intended, one of the pieces that I'm involved with is the development of national standards for the built environment, the physical environment of long-term care facilities, which is being developed right now. And we are definitely moving to incorporate those, and they were not really there before. So agreed, we need to make sure that there's also training and support for architects, engineers, and builders around it. So we talk to builders, they're like, we are happy to make this inclusive design. What is that again, and how do I do it? So we need to make sure that we're supporting capacity building and knowledge, because it's an opportunity for them in their workplace as well.
Yeah, so what I'm going to do is I'm going to read out a comment from Ben, and then Neil, I don't see a lot more questions right now, so I'm going to read this comment from Ben and invite Mike and Laura to reference it or reflect on it if they like. And then Neil, if you're still interested, very great points that you put there. I'll invite you to share those on camera and on mic with us to wrap up this section. Ben writes in chat, marginalization is a huge issue. As an LGBTQ2+ individual and advocate, and I'm assuming BIPOC individuals have the same concerns, entering an institution where institutionalism has a very negative impact throughout my life and many others, this definitely needs further attention. So I think there's a very important issue in a different dimension about equity that Ben's bringing. I want to thank you for bringing this topic to our conversation. So I'll invite Laura and Mike to reflect on this issue of inclusion.
Just very quickly, I couldn't agree more. We've been working very closely with a number of different communities, and there was a comment, I think it was Peter, that said, why is it so focused on Toronto? I think that's just because the community there, particularly with our queer communities, have been really engaged in this. We need to make sure that this is much more competency-based in terms of training, supports, and integration across our basic standards of care. I would encourage you to reach out to the HSO and make sure that that becomes aware. The good news is there's both a queer and BIPOC person running that. So Dr. Samir Sinha is actually very personally involved in that conversation. The other piece we want to make sure that we're thinking about is that many older people of different identities feel uncomfortable with physical care unless they know that they will be safe and respected. That's particularly true for hands-on care, showering, bathing, and so on. And we hear people who say, I can't possibly go to a medical practitioner because I don't feel safe having someone else touch my body, or I feel concerned about how I may need to hide my identity and go back in the closet. These are real and profound issues, and again, goes to safety on a different level.
Yeah, I completely agree, Lauren. And the only thing I will add is if anyone is experiencing that type of discrimination, to go to the Ontario Human Rights Commission, because the OHRC is there to ensure that your human rights are respected and upheld. But obviously we want to prevent you ever being in a situation where you have to go to the Ontario Human Rights Commission, because we've integrated inclusivity into all aspects of all of our institutions, but especially long-term care as it applies to this conversation.
Thanks so much. I really appreciate and thank both of you, but also Ben for bringing this part of the conversation to our conversation today. All right, Neil, you're up. If you want to turn on your camera, if you want to unmute, then we'd love to hear your response to Mike's 3 questions, and then it'll be time for us to wrap up our time together today.
Sure. Thanks, Sean. So, Mike, first of all, I'd say good news. You obviously get it, so I don't think there's a whole lot we can educate you on here, and it's really reassuring just to hear you and hear your thoughts. I guess my concern here is that this is such a huge problem, and it's been a big problem forever. I mean, I was a graduate student in the early 80s. I remember an American academic, Bruce Vladeck, wrote a report called Unloving Care about the nursing home industry in the US, which could have been written about Canada. That was in 1980. And basically the situation is pretty much the same, only a whole lot worse. Like the funding has declined. The issues, I think, have gotten more profound and clear. I mean, COVID made it, starkly obvious. So I guess for me, the question is, so how we really make sure that we don't, and I should say, I mean, I'm all for what Samir Sinha is doing with HSO and so on. I have a bit of a stake in that. I'm involved as a volunteer with HSO myself, but I just, I worry that a bit more regulation, a few standards is just going to be, isn't going to address the underlying issues and the fact that something we just haven't come to grips with. And so, and I look at, again, there's some great home care providers, but they're just pitifully funded and can provide such, puny services really in the scale of things that they do not represent an alternative or something that bridges to long-term care. So somehow we need to get in there and do something much more fundamental. I mean, it's going to take a lot more resources. And certainly if you look at countries like Denmark and the Netherlands, they spend way, way more, multiples more than we do on care for seniors. And it seems to me the political will's probably there. There's enough of us, for goodness sakes, who are seniors or who will be soon. And so I think, I think there's an opportunity for the Green Party to really stake out some kind of dramatic ground here. And then I guess, the last thing is just on nursing homes. I do think, clearly we need to fix them. And I don't want to be Pollyannish and suggest that no one needs to be in a nursing home, but we don't need to have nursing homes that accommodate hundreds of people and are run like huge joints and are funded at a level that they really can't provide anything like decent care. And it does seem to me we need to rethink the model. And these things like, Laura's butterfly models, I think are exactly what we need to be talking about, but at the moment, they're just not even dressing on the cake. There's so few of them that none of us can realistically hope to ever get that kind of care, or we would have to be like, super consumers to make sure we were lined up for it at the right time. And so, it's nice to have good models, but we need to sort of get them to scale.
Thank you so much.
Sorry, I've probably spoken more than you wanted.
No, that's fine. This is such an important time, and we just so value you sharing, you and everyone else sharing what's on your mind, what's important to you. That this is the critical first step in representative democracy. If those who represent you don't know what's important to you, what your priorities are, and what your stories are, and why those are your priorities, then we are doomed to fail. So thank you, everyone, for your sharing, for your trust in this time and space, and for your time just to come and join us, with a special thanks to Michelle's dog for that lovely cameo in the middle. You know what? We are out of time, so I'm going to pass things back to Mike to close things off. But just before I do that, I want to let you know that this isn't the only opportunity for you to connect with the Green Party of Ontario around our platform. We have an online survey. So if there were things that were important to you that you would like to make sure that we're tracking, or if you didn't have a chance to participate in the way that you wanted to during today's town hall, please fill out that survey. The link will be in chat in just a moment. And with that, I will hand things back over to Mike Schreiner.
Thank you, Sean. And I'm going to go off script. And just because Neil's words were so powerful, I wanted to give Laura an opportunity to reflect. And then I'm going to reflect in my closing, if that's okay. And I've told my family, you have to hold off a few more minutes. We're going to go past 3 a little bit. So Laura, did you want to reflect a bit?
Well, first of all, it's lovely to have Neil here, who is himself a profound expert and one of the leading voices in seniors care and patient care and neurotrauma. So thank you for all that you've done, Neil, to move this conversation forward and your time and dedication. The good news is this: we know exactly how to fix seniors care, report after report. And I think at this point, consensus conversation after consensus conversation, it is so critically important that we are having these political conversations because we know we need to improve staffing, because we know the built environment needs to change, because we know that we need to be looking at models of spending more money on seniors care in more effective and efficient ways, in ways that we know, like aging in place at home, are much cheaper and much preferable to people. We have an aging population. It's not going to go away if we close our eyes. And so conversations like this lift me up because it is democracy in process. It is delightful to see that organizations like the Green Party are wanting to hear from Canadians and building their policy platform around both evidence-based goals, but also really humanitarian perspectives to aging. So our organization CanAge is nonpartisan, nonprofit, and leaning in one direction or the other. But what I can say is we're really encouraged to see the work of the Green Party really taking to heart both the stories of individuals and how we can move the science forward to transform a system that we know how to transform and to bring that political will forward. It's been a real pleasure to spend time today. Put my personal information in the chat, easy to find, canage.ca, and the email is easy as well. It's just Laura, Laura at canage.ca. Thank you so much for your time today. It's been an honor and a pleasure.
Thank you, Laura. It's been an honor to have you with us, and your expertise and your passion just shines. And Neil, I just wanted to reflect really quick on your comments. You know, politically, one of the things I've thought a lot about is how do we build the political will given the moment we're in? Because you're right, like how many times has the Toronto Star done exposés on the crisis in long-term care over the last 2 decades? How many reports have come out outlining the challenges, the problems, the gaps in the system, and we haven't built the political will to make the investments needed to improve care. And so one of the things I've tried to do, and it can be incredibly challenging in a partisan political environment, is to hold the current government accountable, but not just cast all the blame on Doug Ford or Marley Fullerton, but to talk about we, and I say this a lot, we as a society bear responsibility for the humanitarian crisis that we've seen during COVID. None of us can escape the responsibility that we all hold. And so we collectively as a society is going to have the political will to make the investments needed and to elect people to office who are going to make those investments. And so I think we all share a burden of responsibility. And so I've been trying not to make it too partisan, but I still, I'm still not going to let the premier off the hook on this one either, but a bit of both. And then the other one that's maybe a deeper and harder one that I was reflecting on is I think Sean had a beautiful opening with his land acknowledgement, and just to say, many indigenous cultures honor elders in a way that kind of settler Western culture does not. And I know it's harder to change those deep cultural ways in which we live our lives. But, my hope is that one of the profound changes that come out of this, nightmare we've all been living through for 14 months is a culture shift that honors caring more and honors elders more. And whether or not that happens, I don't know, but I think, the only way it can begin to happen is through conversations like this and many conversations like this. And so, I just want to close, I guess, by just saying how deeply I appreciate everyone who's joined us today, who's a part of the conversation, who's part of the movement to improve the way we care for elders, to provide the dignity and respect that I think Michelle so eloquently talked about. And so I just want to really thank all of you and encourage everyone who's on this Zoom call today to stay involved, stay engaged, press the Green Party, press all the other parties to really build the political will we need to provide the care and respect that our elders deserve and the people who care for them deserve. So thank you, Sean, for being such a great moderator. Thank you, Laura, for your expertise and your passion and your commitment. And thanks everyone for joining us today. Be safe, be well, and we will get through this COVID pandemic, and we will, I hope, build a strong platform that will inspire people in the next election. Thank you, and have a good day, everyone.
Thanks, everyone. A final thank you, and thank you, Mike, for the call to stay engaged. Just a reminder about that survey. Maybe we'll get the link in chat one more time. Also, we have more town halls coming up on other urgent and important issues, and we have the Green Party of Ontario Convention coming up if that's something else that you'd like to be part of. Thanks, everyone. We really hope to see you at more town halls soon, and stay part of the conversation, and please let us know what's on your mind so that we can do our best job to represent the people of Ontario. Thanks, everyone.
Thank you.